Welcome to The Explainer. Today, we're unpacking the fascinating and frankly heavily misunderstood world of hormonal imbalance. Look, if you've ever felt like your body is sending you signals you just can't quite decode, you are in exactly the right place.
We're going to start things off with a massive, myth-busting question. Is estrogen just a female hormone? For decades, popular culture has kind of just assumed it is. But when we actually look at the clinical science, the answer is a resounding no.
Okay, let's dive into this. In women, estrogen is absolutely crucial. It regulates the menstrual cycle, maintains bone density, and stabilizes your mood. But look over at the men's side of things. It is equally vital for sperm production, bone health, and even brain function. So, it's a foundational hormone for daily human functioning, completely regardless of your sex.
So here's our roadmap for today. We're covering 1. The female hormone myth. 2. High estrogen in women. 3. High estrogen in men. 4. Hidden causes of imbalance. 5. Getting a proper diagnosis. And 6. Restoring your hormonal balance. Section 1. The female hormone myth. Demystifying estrogen.
Before we go any farther, we need a clear scientific anchor. The clinical term we're dealing with here is hyperestrogenism. Basically, this is just a condition where the estrogen levels in your bloodstream rise above the normal range for your specific age and sex. You'll often hear people call it estrogen dominance, which just means your estrogen is spiked way beyond what your unique body actually needs.
Section 2. High estrogen in women. Recognizing the signals.
For women, we are talking about heavy, unpredictable periods, breast tenderness, and unexplained weight gain, specifically around the hips and thighs. Add to that severe mood swings, fatigue that totally ruins your sleep, frequent headaches, and a noticeably low sex drive. If you're experiencing this daily life-ruining cascade of symptoms, let this be your validation right now. These signals are not just in your head, and it's not just stress. They are very real biological responses to excess hormones.
Section 3. High estrogen in men, the overlooked imbalance. Now, the ways excess estrogen wreaks havoc on the male body might actually surprise you. We're talking about gynecomastia, which is enlarged breast tissue, alongside erectile dysfunction and a reduced sperm count. You might also notice weight gain concentrated right in the belly, profound fatigue, a loss of muscle mass even if you're working out, and even depression. It's so vital that male viewers feel validated here too. Estrogen dominance is just as real and just as disruptive for you.
Now, what's really interesting about this slide is this incredibly tight window, 10 to 40 picograms per milliliter. That is the standard normal estradiol range for men. Because this window is so narrow, any significant rise directly interferes with your testosterone. Elevated estrogen essentially suppresses testosterone, which sets off that whole frustrating cascade of symptoms we literally just discussed.
Section 4. Hidden causes of imbalance. What's driving the spike?
And this brilliantly illustrates what's actually happening behind the scenes. Take excess body fat, for example. It literally contains an enzyme called aromatase that actively converts your testosterone into estrogen. Crazy, right? Or consider your liver. If it's stressed out by a poor diet or too much alcohol, it clears out old estrogen way too slowly. Then we have xenoestrogens. These are chemicals in plastics like BPA that actually mimic estrogen inside your body. And finally, chronic stress elevates cortisol, which then suppresses progesterone, leaving your estrogen to just run completely unopposed.
Section 5. Getting a proper diagnosis. Beyond guesswork. Okay, I have a bold, absolutely crucial warning for you right here. Avoid over-the-counter hormone testing kits. They simply lack the clinical accuracy required for something this delicate. Relying on them almost always leads to unnecessary anxiety or, honestly, even worse, incorrect self-treatment. You need real clinical data. To get a true diagnosis, you need specific clinical blood tests. You absolutely must get your estradiol, or E2 levels checked, along with a total estrogen panel. For men, your doctor has to check your testosterone and SHBG as well. And for women, checking progesterone is absolutely vital to assess that total ratio. True recovery requires a precise medical roadmap, and that all starts with accurate, professional blood work.
Section 6. Restoring your hormonal balance, taking back control. All right, here is your clear 3-step action plan to guide you right back to your baseline. Step 1. Get clinical blood work so you're not just guessing. Step 2. Make targeted lifestyle and diet tweaks. And Step 3. Seek medical support to guide you safely through the entire process.
Let's zoom in on those lifestyle tweaks for a second. These are highly accessible, natural interventions that energize your body's own ability to excrete excess hormones. Prioritize weight loss to lower that aromatase enzyme we talked about. Eat a high-fiber diet to literally flush estrogen out through your gut. Give your hard-working liver a break by cutting back on alcohol. Definitely choose BPA-free products to dodge those sneaky xenoestrogens, and actively manage your sleep to keep your stress cortisol in check.
You know, here's a fantastic, highly specific dietary hack. And yes, your mother was actually right. Cruciferous vegetables, things like broccoli, cauliflower, and Brussels sprouts, contain a compound called indole-3-carbinol. Now, this compound actively supports healthy estrogen metabolism. So just adding a hearty side of broccoli to your dinner is a direct, science-backed way to help balance your hormones.
But look, sometimes natural lifestyle steps just aren't quite enough. And honestly, that is perfectly fine. When you do need medical interventions, targeted support is readily available. Doctors might prescribe aromatase inhibitors, which are often used in men to stop the conversion of testosterone to estrogen. For women, progesterone therapy can effectively counterbalance that estrogen dominance. A doctor can also treat any underlying issues like thyroid or liver conditions. The whole goal is just to find the right clinical tool for your specific biology.
So we're going to end on this final provocative thought. Are your daily symptoms trying to tell you a hormonal story? Whether it's stubborn belly fat, unexplainable fatigue, or wild mood swings, your body is trying to communicate with you. I really hope this explainer leaves you empowered to investigate your own health, seek out the right tests, and finally take back control of your vitality. Keep learning, keep asking questions, and take charge of your well-being.